And now, Doc Talk, brought to you by Plateau Medical Center. Here's Dr. Paul Conley.
Good evening, I'm Dr. Paul Conley, and thanks for tuning in to another episode of Doc Talk. This evening we're going to be talking about coronavirus, otherwise known as COVID-19. Coronavirus was initially discovered in Wuhan, China in the fall of 19, and unfortunately has continued to carry on into 2020. It's been a global spread. We feel that this virus, the coronavirus, initially started out in an animal model and then infected a human being, which then has caused global spread. We're now in this pandemic with ultimately we've had over 9,000 deaths globally, and we continue to see deaths on the rise. Tonight we have two experts here locally. We have Dr. Anita Stewart, who is the Fayette County Health Officer. We also have Dr. Scott Keffer, who is our hospitalist here at Plateau Medical Center. So thank you guys for coming in tonight to talk about COVID-19. So first of all, I think, what I'd like to talk about, to the people watching the show is the transmission, and how this virus, coronavirus, which is a virus that causes this respiratory syndrome that we saw like with SARS, then the Middle Eastern strain, this is somewhat similar to that. I think, there's been a lot of concern about how it's transmitted, how infectious or contagious. We hear these words of respiratory droplet versus airborne. So maybe Dr. Stewart, you can talk a little bit about how it's transmitted throughout the community.
Yeah, so it acts a lot like influenza, and a lot of people are familiar with influenza, so I like to compare it to that. It's spread in a very similar manner. So it's spread with respiratory droplets that can get into the air. It can go up to 6 feet, so that's where the 6 feet spacing comes from. And it can be spread also on surfaces. So if someone sneezes and it gets on a surface, it can also be spread in that manner.
So when we talk about social distancing and this respiratory droplet, is it at all concerning if you're in the same building or out in the public or in a park? I mean, is it transmitted that easily that way?
No, it typically has to be a close contact, so someone that's in your proximity, usually within the 6 feet window, and that would be a prolonged contact as well. Or if you were with that person and they sneezed, coughed, or somehow got respiratory droplets into your face, the mucous membranes, that you could potentially be infected.
So when you talk about that transmission, so someone that has sneeze or cough, can you kind of go over like what is the proper way now, I guess, to actually sneeze, and how do we cough, and how do we protect, touching face and things like that with our hands?
Right, so the most important thing is that we're not infecting ourselves or that we're not infecting others. So if you do have a cough or sneeze, it's important to either cough into your elbow and turn your head, or to use a tissue over your face at that time, and then to immediately wash your hands for 20 seconds, or to use hand sanitizer to help reduce the droplet burden that could potentially be on your hands and that could affect others.
So, there's been, as you know, there's been basically this entourage of people going to the stores. Everyone's rushing out buying hand sanitizer to where the local police department and our first responders are having a hard time finding hand sanitizer. What about, I get questions about soap, and does it have to be antibacterial soap? What about soap and water? How effective is that in relationship to the hand sanitizer?
So soap and water is equally effective, and I think it's a great option without really drying your hands out as much as using the hand sanitizer. So the key, though, is that you're washing your hands for 20 seconds. So that's the Happy Birthday song twice, or the chorus to Country Roads. Everyone knows that in West Virginia. So using that whenever you're washing your hands. And then certainly if you do touch your face, really try not to do that. But if you do that, you're going to want to wash your hands again. It doesn't matter if it's antibacterial or not. Soap, any plain soap is fine.
So I think, the soap in general, I think, one of the things is it does break down that lipid layer that the virus, basically has as far as the membrane, and then just the mechanical action of the water just mechanically washes off dirt, grime, bacteria, and virus, down the drain. So you're actually washing it off your hands. So let's just talk a little bit about if someone, feels that they may have coronavirus, what are some of the symptoms? You know, we hear about certain things having upper respiratory symptoms. We know coronavirus is more lower respiratory, so maybe a comment about sneezing versus coughing versus, and maybe you can touch on that a little bit.
Yeah, so the hallmark for coronavirus is it's a lower respiratory type of illness. And so the most common symptom is fever, and that's about 88%. And then the next most common is cough. That can be either a dry, hacky cough, or it could be a productive cough. We're seeing both of those presentations, but those are the two most common symptoms that we're seeing with coronavirus. We typically see a slower onset of illness versus the influenza virus, where we see kind of an abrupt, I feel like I got hit by a car symptom. The coronavirus, we're seeing a more gradual progression, with days like 5 through 8 being the most symptomatic, and where we see more of the shortness of breath and respiratory distress related to coronavirus.
Yeah, so, you know, when we talk about the flu, you know, we talk about incubation period. So if I were to have influenza and I were to transmit that to you, we know that there's a certain window of time. Can you talk a little bit about if someone were to come in contact with someone with coronavirus, what is that incubation period that one may not even know that they have coronavirus before they have those symptoms that you're talking about?
Yeah, so it is very tricky, because you can have asymptomatic shedding of the virus, which means that you can potentially spread and infect others and not even realize it. And so that's anywhere from 2 to 14 days. So that's quite a long time to be potentially shedding virus. The other tricky thing is that we know, particularly children, are considered, there's some postulation that they're potentially vectors for this, which means that they might be able to shed and spread the virus, but not necessarily have symptoms. So that's one of the concerns related to COVID-19.
So I know, like, you know, Dr. Keffer, you know, you do a lot of work in the nursing homes, and I think, you know, those are the people that we're really, really concerned about. You know, it appears, you know, again, looking at data from China and Italy, and now what we're seeing here, it seems that the folks of the advanced age are more susceptible, and I guess maybe you can comment a little bit about what we're doing for our skilled nursing facility patients, and maybe this transmission from the young individual going into a nursing home.
Well, right now, visitation is cut off in our nursing facility, so no one can visit. Even staff that reports have to answer some basic questions. Have you traveled outside the United States? Have you been in an endemic area? Have you been in contact with someone who is ill? Do you have a cough? And then their temperature is checked before they're admitted to the facility. I mean, I even got to put on a green wristband. They were doing green for go yesterday just to get in and to show that I'd gone through screening. And I think that's particularly important because our patients are in a kind of a static environment, except that we have staff that come and go every day, 3 shifts usually. They have children at home that may be asymptomatically shedding this virus, and they may bring it back. But typically, adults are showing signs of fever with this, as Dr. Stewart said, so checking the temperature has been important. But you know, our elders are at great risk. They don't fight off infections like young people. They have a lot of other comorbid conditions. A lot of them have bad lungs anyway, and this additional insult to those fragile systems can be and has been all over the world very devastating. So we're doing everything that we can to prevent that. Everything from you know, ramping up our cleaning schedules to washing hands every couple of hours, wiping down surfaces they come in contact with, their wheelchair arms and their bed rails. And trying to keep the environment clean. The staff is kind of doing a process of foaming in, foaming out. You know, you do hand sanitizer when you go in, you do hand sanitizer when you go out. Everybody's hands are starting to look like snake skin already. I'm not sure how long that can last, but it is all done in an effort to keep those people safe, because once something spreads in that setting, once it takes root in that setting, it spreads rather rapidly, and it's hard to put the lid back on Pandora's box at that point.
And I think that's, you know, one of the things, you know, that folks need to be aware of is that, you know, a lot of the kids are obviously, or not all, a lot of the kids, I guess, all the kids are out of school, and so they're at home, and I think they're wondering, you know, why do I have to be, in a sense, you know, tied to the house? Why can't I go out? And I think, you know, that's a good point you make, because, again, as a reservoir, as a vector, that you can go into a nursing home and just, you know, giving grandma a hug could be fatal, to grandma. And then again, once it gets within the nursing home, we don't have at this point, any treatment, to date for these folks, and so it's supportive therapy. Getting back to a little bit about, the transmission of this virus. We talk about, within the hospital and the nursing home, and you see people buying up all these masks, all these N95 masks, and we call this PPE, this personal protective equipment, is what we mean by PPE. Maybe you can talk a little bit about, how important that is with PPE and some of the shortage that we're seeing and how that prevents transmission. Anyone, you want to take that question?
I can take that one. So currently in the guidelines, a simple surgical isolation mask is what's recommended, except in a couple of situations. So the N95 mask is recommended when forced air is used and that can create its own aerosolization of those viral particles. So if we're intubating someone's gotten to the point they have to be put on a ventilator, you should be wearing an N95. If someone is working with the ventilator, once someone's on it, there's forced air pushing those particles around, they should have the N95 on. This patient should be in a negative pressure room. If you're doing a bronchoscopy, a procedure where you may be putting a tube down someone's throat and suctioning or investigating their airways, N95 should be used, but only in those situations are those recommended. So the person who feels like they have to go find 5 cases of N95s at Lowe's to wear to the grocery store is taking those away from people who may need them. They're wasting their money, and it's just overkill.
So the folks that you see, walking up and down the street here in Oak Hill don't need to be wearing N95 mask, and if you're doing social distancing, not shaking hands, not getting within that 6 feet, even the surgical mask, is probably something that's not even required. Is that correct?
Right. There's not great evidence to support an asymptomatic person wearing a mask to prevent them from getting sick. There's some evidence that maybe it prevents you from touching your face as much. If that's on there, it creates an increased awareness. But I don't see that personally. I find that I touch my face much more when I have, or almost touch my face when I have the surgical mask on versus otherwise. So it's really, again, taking, like Dr. Keffer said, is taking away special equipment for our healthcare providers, our EMS providers, our police officers, our first responders that really need that equipment, and it's not really going to benefit you much if you don't have any symptoms.
If the patient has a cough or has, at home, does it help that person who's actually spreading the virus, who maybe has the respiratory droplets? Would that be an individual that maybe would benefit from wearing a mask in that setting at all?
I would say not more than coughing into a tissue and disposing of it and washing your hands.
Yeah, I agree.
Well, I appreciate that. We're getting ready to come up to a commercial break here, and when we come back, we're going to talk a little bit about vaccine, we're going to talk a little bit about treatment, and we're going to talk a little bit about testing and how we're doing things in the hospital as far as admissions and triaging. So for those of you watching, this is Dr. Paul Conley, and this is Doc Talk.
At Plateau Medical Center, we have the newest technology, which is robotic surgery. Prior to us getting it, you would have to travel out of the area into a larger hospital. By using the robot, less pain, quicker recovery time, quicker return to normal activities, and shorter hospital stays.
This new robotic platform allows us to do what we do and do it even better, and that's only going to benefit our patients.
It's not about the technology, it's not about the robot, it's about patient outcomes.
This is Doc Talk, brought to you by Plateau Medical Center. And now, Dr. Paul Conley.
I'm Dr. Paul Conley, and thanks again for tuning in to Doc Talk. We're talking about coronavirus and the COVID-19 pandemic that we're seeing. And it is here in West Virginia. So again, we're talking a little bit about transmission, and we talked about social distancing. Obviously, the governor has come out and has basically no schools in the state of West Virginia until further notice. That means other social gatherings, the basketball tournament, NBA season, these have all been canceled. And they've talked a little bit about, this number 10 as far as in kind of a social gathering. We talk about people, they're still wanting to go to church, or still wanting to go to the birthday party we're going to have for grandmother this weekend. Can you guys talk a little bit about, how important that is to avoid that, and that's not really a good idea right now?
Yeah, I think it's important to know that, again, you can be asymptomatic and still spread the virus. So the more people you have together, the more likelihood that you would have to spread the virus, and then you're not going to be able to trace it either. And so really stay home, don't go to church, don't go to birthday parties, don't give grandma COVID-19 because she could potentially die from that. Stay home, and it's really the only way that we're going to be able to slow the rise of the virus, which can help maintain our healthcare resources for us to be able to support the illness in our community.
Yeah, we talk about this curve. You can either want to have a really sharp curve and like this, or you can, as we say, flatten the curve. You may have the same number of sick people, but you spread out over time. I was talking to a patient just earlier about a scenario of if I have a funnel and I have a gallon of milk. Now that funnel can only basically handle a certain amount of milk at any given time, but if I pour it slowly, it won't overwhelm the system, and the system can handle it. But if I take the same 1 gallon of milk and try to pour it too quickly, it overwhelms the system. And I think that's maybe what we're talking about here, because we talk about healthcare providers. If any one of us, are sick and unable to take care of patients or on a ventilator, therefore the whole system, begins to crash, because now you have healthcare providers trying to save other healthcare providers, and then therefore, not only that demoralizing the staff and physicians, but then it also creates an issue that we just don't have enough boots on the ground to take care of these people. So in saying that, I think, if someone feels like they have COVID-19, what should they do? I mean, is this something that they should go straight to the emergency room? Is this something they should go to their MedExpress? Should they go to the physician's office? How should they present if they feel that they have the virus?
I think I'm trying to think about this in the way that if I were ill, if I were sick. And I've also tried to think about ways to describe this to people so that it makes sense to them. And I think that what makes the most sense to me, and I've tried it out on some of my family and friends, I think we should all just assume that we have it, and that everybody that we come in contact with has it. And not unlike when we have a cold, when we have the flu, when we have bronchitis, we don't go to the emergency room just because we think we have bronchitis. We go to the emergency room to the doctor when we have a level of symptoms that needs more care than we can provide for ourselves at home. And I think if you think about things in that vein, first of all, social distancing, washing your hands, keeping your hands off of your face, coughing into your sleeve or into a tissue. If you assume that you have COVID-19, do those things to protect those around you. If you assume that the person close to you, 4 feet from you, has it, you might back up 2 feet, because if they happen to cough unexpectedly, that can't get to you. And that's how you protect yourself. But also, again, you don't go to the hospital or to the doctor's office because you think you have it. The only reason to go to see your doctor, to talk to the health department, to get online with some telemedicine, is if the symptoms are getting to the point that you need more help than you can provide for yourself at home. If you're so short of breath that you can't walk from one room to the other. I heard someone describe, if you get up every morning, take a deep breath, and you start noticing you can't hold it for more than 10 to 15, 30 seconds when you usually can, there might be something going on. Those are things you could do to help you decide whether to go or not. And then I think Dr. Stewart can tell us really well about, once you arrive at the point where you know you need help, what are the best avenues to pursue?
Yeah, so the best thing to do is to call your provider or to call the emergency department ahead of time. If you're sick enough to call and activate the emergency response system or 911, you need to tell them when you call that I'm concerned that I might have COVID-19. It's when we know ahead of time when people are coming in with those symptoms, we take extra precautions. We have them call when they get to the office. We meet them outside. We try to minimize any extra exposures that they could have to staff or other patients that could potentially spread and cause illness amongst others. So really trying to isolate them, keep everyone ahead and aware of what's coming to us, and that way we can be prepared and take care of them as quickly and efficiently as possible.
Yeah, I think that's a good point. If we all, it's kind of like the person that rides a motorcycle. And you're always taught assume that you're invisible. Okay, if you assume that, same thing as assume that everyone around you has COVID-19. If you basically assume that, then you'll perform that social distancing. Because I know, again, we talked about, right now is probably not the time to be, going to church. It's probably not the time to be, going to some of these other social gatherings, right?
Right. Yeah, I think it's the best thing that we can all do as citizens to keep everyone else safe. That's how we can do our part by reducing the rise of the virus and hopefully mitigating the spread in our community.
Because I think ultimately, we'll get through this, okay, but we have to, and again, take a time out, from some of our things that we do, our social liberties and everything. But this is, in a sense, this is a crisis. This is like a war. I mean, this is a war, against a deadly virus, and it's killing people. And we've had, thus far thousands of deaths, and it is continuing to rise. So again, when we talk about, stay at home. So, like with influenza, we have a treatment. We still don't actually recommend that's where people come running to the hospital or to the doctor's office, but we can do a phone triage and we can call something in. Where are we at right now as far as a treatment for COVID-19?
You want to take that one?
All we have now are some anecdotal reports that physicians and healthcare systems in other countries have used combinations of antivirals, and some of which we can't even get our hands on. And I'm certain that there are some remedies that have been tried in more tribal areas that maybe they've been effective. Maybe that'll be guide us toward a treatment in the future. But there's nothing right now that we have in our armamentarium to treat this virus. No humans prior to last fall had any exposure to this virus. So not only do we not have treatment, none of our bodies have any of the immunity built up to fight this. And that's why it's been so devastating. That's why that's hurt us so much more rapidly and severely, is that there's no experience on Earth with this virus in the human body. So there's no immunity that we can draw from in our DNA or in our immune systems to fight this.
So we're talking about treatment, we're talking about supportive care. So we tell that patient, stay home. Okay, we don't have an antiviral, but we do have treatments as far as for fever, for body aches. And there's been a little concern, and maybe we can comment about what anti-inflammatory should I take? Acetaminophen, brand name Tylenol, versus ibuprofen, Motrin, Aleve. There's been a little concern about possibly that one's better than the other with this COVID-19. Dr. Sir, can you comment a little bit about that?
Yeah, so like Dr. Keffer alluded to, this is uncharted territory, but we are starting to see some evidence for therapies that could potentially be effective or one over the other. And so the recommendation currently is to use acetaminophen or paracetamol. You might see it written like that in the articles. That's what they call Tylenol or acetaminophen in Europe. That seems to be more beneficial over the NSAIDs or anti-inflammatories like ibuprofen, Motrin, things like that.
So let's talk a little bit about vaccine. We have talked that there are vaccines for flu, and again, I still really recommend that we still make sure we get our population vaccinated. We have vaccines for pneumonia, Pneumovax, and Prevnar, which are the trade names. What about when we talk about vaccines for this virus? Where are we with that?
I think they're looking at vaccine trials in other countries, particularly China. I know that there was some studies that they were doing for vaccine trials. At this point, we don't have a vaccine, and so it's all prevention-based, and it's all really focusing again on good hand hygiene, not touching your face, social distancing, and just being mindful and using common sense to help reduce the spread of the virus.
We were on a conference call, and we're talking about testing, and I know you're heading up, and we've seen on other areas doing drive-through testing, availability of testing. Can you comment a little bit about what our availabilities of testing are, what type of testing that is, what's our turnaround, and possibly about the drive-through testing that we've been hearing about?
Sure. Testing has been a very complex and controversial issue. We are currently in West Virginia and across the nation very short on the viral transport media, which is the collection apparatus that we would put the swab in when we would do the test. It's a nasopharyngeal swab, which means it goes in the nose back to the back of the palate, and we can send that for testing to either our state lab or to, there's other private laboratories that are also doing the testing. We are following the strict guidelines by the CDC, which follows symptoms of fever and cough, as well as potential travel exposures. And then they've expanded the guidelines to a patient that's symptomatic over 65, if you're in a long-term care facility, or if you have chronic diseases and don't have another explanation for your illness, or if you're critically ill and we don't have another explanation or another disease that's causing that. But it is tricky right now because we are really short on supplies. We are working on doing drive-through testing in Fayette County. That'll be by referral only through the Fayette County Health Department, so patients can call themselves and self-refer. If they meet criteria, they'll be scheduled for a time to show up for the drive-through testing. They can also, their healthcare provider can also call and help set that up for them. The most important thing, though, is if we're concerned that they could have COVID-19, is that they would self-isolate until they would get the test results back, starting from the point of the discussion with their provider or with the health department of the concern of potential virus. So staying isolated is very important.
What is that turnaround time? How long does it take, for that person to get those results? And I guess with the drive-through testing, are we testing for any other viruses such as influenza A or B or this respiratory panel? What test is offered and what is that turnaround time?
Yeah, so we're looking at doing, the first thing we'll do is a rapid influenza test. If that's negative, then we would proceed, if they meet criteria, to doing a nasopharyngeal swab, and then that can go for, it's called a viral respiratory panel, which is usually a panel of about 20 typical respiratory pathogens or things that could cause respiratory infection. And then if that is negative, they will move that to the COVID-19 testing. The turnaround time from the West Virginia Office of Laboratory Services has been quite good. It's usually between 24 and at the longest 72 hours, but most of our specimens have been within 24 hours for both of those tests. And then external laboratories like LabCorp or Quest are usually on the turnaround time of 3 to 4 days upon receipt.
That's really great. So we're going to take another commercial break. I hope you guys stay with me. Some things I want to talk about when we come back is about if someone does have COVID-19, how long are they contagious, how long are they infectious, when can they go back out in the community. We'll talk a little bit about hospitalization, what we're doing here at Plateau Medical Center. So stay tuned. I'm Dr. Paul Conley. This is Doc Talk.
Plateau Medical Group welcomes Dr. Yancey Short to the Plateau Health Network. Dr. Short, a board-certified general surgeon, performs minimally invasive, laparoscopic, robotic-assisted, and traditional surgery. His care ranges for hernia repair, screening colonoscopy, vasectomy, and skin lesion removal. Dr. Short sees patients at 2 convenient locations, West Maple Avenue in Fayetteville and George Street in Beckley. Call our office today or request an appointment online at plateaugeneralsurgery.com.
This is Doc Talk, brought to you by Plateau Medical Center. And now, Dr. Paul Conley.
Welcome back to Doc Talk. So we were just talking a little bit about the virus and talking about, if you feel like you may have the virus, and we're talking about being tested. And so again, these criteria that you just alluded to, Dr. Stewart. So the patient comes for the drive-through testing, they meet the criteria, they go home, they self-quarantine, they get the call, you have COVID-19, okay? What does that patient then do? What is the sequela after the diagnosis that they have the infection?
So typically it's a mild infection. For 80% of people, it's a mild infection. And we'll be monitoring that from the health department, monitoring symptoms, doing contact tracing to see who the other people could have been exposed to. And then they'll be home for at least 7 days. And then regular social distancing if they've been symptom-free for at least 72 hours.
So basically that individual, as far as getting back out into the public, symptom-free means no cough, no fever, no body aches. And I guess in saying that too, there's been some question about, the immunity. And so in saying that, if you were to contract COVID-19 and fully recover, which the vast majority will, does that person have immunity? Can they be reinfected again? Anyone?
Yes, they can.
So it appears that they do not have an immunity after that. So again, that gets back to the point that, once you get back out into mainstream public, you still need to say, I need to social distance myself.
Correct.
So when we talk about social distancing, at the break, we're talking about, how fortunate we are to live in West Virginia. So let's talk a little bit about maybe some good things. It's not all dark and dreary,
Right.
It's not the apocalypse, the sky's not falling. We are going to get through this, And I think, by doing the things we're doing up front, it may be, hampering our lives a little bit, but, we're coming in spring. And so, maybe we can talk a little bit about what activities one can do as far as, that's perfectly fine, perfectly safe.
We're so fortunate to live in the state of West Virginia. The population density is not what it is in most states. And we have this great wonderland to play in. So we say stay at home, but what we really mean is kind of stay away from dense population. So I can walk out my back door and get on a trail and walk for 4 or 5 hours and probably never see another human being. We all have those opportunities. We can take our kids for walks, we can ride bicycles, we can go fishing, we can dig ramps, we can do all kinds of wonderful things out in nature that are fulfilling, that are creating memories with our families. And maybe, if there's anything to come out of this that's good, maybe we can create some really lasting memories with our families.
Yeah, I really appreciate both of you folks coming on. This has been, a wealth of information. We're still, soldiering through this, but I do feel that, with experts like your folks and what we're doing here in the community, we're going to get through this. And I really appreciate you guys coming on the show tonight.
Thanks for having us.
Well, this is another episode of Doc Talk. I'm Dr. Paul Conley, and until next time, good night.
This has been Doc Talk with Dr. Paul Conley, a presentation of Plateau Medical Center.